This is TTT Live. I'm DK Rosta. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Manager of Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning, Trinidad and Tobago. Happy Monday morning to everyone. It's a beautiful day outside. It's as though nature knows that today would have been Carnival Monday, but we continue to find creative ways to enjoy our culture. And thank you for tuning in to another virtual media conference hosted by the Ministry of Health, which will provide an update on the national COVID-19 response from a health perspective. Today with us are Dr. Roshan Parashram, Chief Medical Officer, Dr. Adish Serju Singh, Director of Women's Health at the Ministry of Health, and Dr. Joanne Paul, Medical Chief of Staff at the Eric Williams Medical Sciences Complex. I am your moderator, Candice Alcantara, and also the Manager of Corporate Communication at the Ministry of Health. Today we focus in quite a bit on our women and our children who've just returned to school. But before that, Dr. Parashram will present the clinical update.
Hi, good morning. Thanks, Ms. Alcantara. Morning to Dr. Serju Singh and Dr. Paul, as well as members of the media and viewing and listening public. So I'll begin with the clinical update for February 14th at 4 p.m., which gives us the number of tests conducted thus far at public and private facilities, just under 90,000, 89,400. The number of cases reported over the last 24 hours were zero. Total positive cases since the 12th of March to present, 7,642. Total recovered patients thus far, 7,346. Total active cases at 158, and the number of deaths now at 138. With regards to our hospital, we have 24 persons. We have no one at our step-down facilities. In our quarantine sites, we have 380, and the total persons in home isolation now stand at 134. With regards to the hospitals, persons are at the Couva Hospital and Multi-Training Facility, where we have 18 persons, and 3 of those are in ICU. At the Cora Hospital, there are 6 persons, and in Tobago, we have no one. Actually, in Tobago, there are 17 days now without any cases on the island of Tobago. With regards to our step down, we have no one in the step down as well. And as I said, 380 persons in various quarantine facilities. If we can go to my first slide, we begin with an epidemiological update followed by some endemic channels. So the epidemiological update first. As of February 14th, second slide. And we are familiar with this graph, which is really the epidemic curve for Trinidad and Tobago. The gray portions are for 2020. The colored portions are for 2021. In green, we have January. So the columns give you an idea of where the number of cases would have been. And the red bit at the end is really up to the middle of February, up to the 14th of February. And we see that our numbers are considerably lower than they were in the earlier part of the year even, with a 7-day average of about 4 at this point. Next slide. So when we look at the age sex distribution, we see again females and males are similar. In this case, we have 46.4% of the cases infected are male, 53.6% are female. And when you look at the charts, we're looking at the age distribution on the left-hand side. We see the majority of cases remain within that 20 to 59 age group, being the largest portion of the pyramid. Next slide. So in terms of our deaths, this slide tells disaggregated by age again, and we're seeing a slightly different trend in terms of the persons infected. Remembering the persons infected more than likely fall within the 20 to 59 category to the most part, but we are seeing with the deaths that the older you get, the higher the rate of death in those particular age groups. And as you go down by age, we see the 80-plus age group accounting for a total of 15.2% of the deaths so far, and the over 70 to 79 age group, 27.5%. And what we have seen in terms of the deaths, again, which is an odd phenomenon that we saw in Trinidad since the beginning of the epidemic, is that 73.9% of our deaths have been in males, and 26.1 in females. Next slide. So this is a quick update where we are at now in terms of the graph. If you look at the legend though, on the right hand side, it's hard to see, but the legend, the white sections are already 0 cases. The slightly light umber color is 1, the red color 2 cases, and the darker purple color is 3. So there are red colors which give you 2 cases per community. It looks larger on the map, but we are depicting communities throughout the country in a GIS format. We see previous weeks would have shown those red dots in the St. George East, St. George Central areas. We're seeing a bit now in the Victoria area and the New River Mayaro area. But again, those numbers are extremely small. They look larger than they are because we are shading in the entire communities. So we now go to next slide. So we're going to tell you the endemic channels. So the endemic channels, you'll see some colorful graphs coming up. So if we go to my first graph, and we have shown this for a little bit of time now, we see on the left-hand side, this is the endemic channel for what we call acute respiratory illness on the left. Again, just to go through the colors and what they mean. So the green portion says that you're in a control level, the yellow meaning that you're in endemic levels, and the pink portion at the top says that you're in an alarm zone and you should be cautious. You're really going towards an epidemic. So how we generate those green, yellow, and pink bits, really getting data from the previous 5 years and getting an average. The black line actually tells you where you're at any given point in time. So we're looking at 2020 and we're into 2021. So we're starting with the ARIs, less than 5 years old on the upper left corner, following the black graph. And we saw in the early part of 2020, up to until March, there was high levels of ARI going into the yellow portions, which is the endemic channel. And then when we started to put our public health measures in place, border closure, social distancing, and all the others, we saw a sharp drop in the number of acute respiratory illnesses. And that has been more or less maintained all the way through 2020. Some little spikes here and there, but not very great. And into 2021, which is the graph on the right, which gives us up to week 5. On the bottom left-hand corner, again, you're seeing ARI greater than 5 years. Again, similar portion in the first quarter of the year, with a spike and then dropping to lower levels. Again, in the greater than 5, of course, the majority of the population that would have been moving and get infected would have been 20 to 59, and we see a higher proportion in the older persons. Again, a slight increase December into January, and that drops off again into February. Next slide. So this one tells you acute viral illness, slightly different from acute respiratory illness. Acute viral illness does not necessarily present itself with any respiratory symptoms, so you're not looking at things like, for example, coughs, runny nose necessarily. Most of the time they present with fevers, body aches and the like, and they're classified as acute viral illness. So again, we're seeing some spikes. The trend is a little bit different for this one. First part of 2020, we had gone into the alarm zone with acute viral illness, dropped precipitously in March, and then a spike where we actually saw the COVID-19 spike in August and September, and it followed the same sort of pattern. So it mirrored our COVID-19 epidemic curve quite interestingly. Again in December, a slight increase coming into the early part of January, and then we see a complete drop-off again into the where we are at now in February. Next slide. So this is with regards to our influenza level, and for the first time in a number of years, again in March into April, we normally have the end of the flu season on May of any given year. We see a straight line going all the way down, which is actually almost close to 0 for the entire year, 2020 beyond April. And again, that continues into January, February, with very, very low numbers of influenza being recorded in Trinidad and Tobago. Our last slide will give you, next slide, a comparison of gastroenteritis. Again, in the country, we have 4 graphs beginning on the upper left quadrant. We see the same spike in the first 3 months of the year, dropped precipitously again into the green channel, which is where we want it to be in the control level, and continues all the way to 2021. Same patterns or very similar patterns we're seeing in both less than 5 and greater than 5. And of course, they can all be linked to the public health measures that have been put in place. Gastro would be affected by, of course, hand washing and hygiene to a great extent, and we see that reflected in the curves above. So Candice, that's my clinical update for this morning.
Thank you very much, CMO. And we hope that all of you are keeping yourself up to date with information on COVID-19 and, of course, the COVID-19 vaccine. And if you're doing that, you've probably already heard that pregnant women are not advised to take the COVID-19 vaccine at this time. Dr. Surjit Singh will touch on this topic in his presentation.
Thank you, Candice. Thank you, and good morning to all. Good morning to our Chief Medical Officer, Dr. Roshan Parasram, and good morning to Dr. Joanne Paul, our Medical Chief of Staff at the Eric Williams Medical Sciences Complex. Good morning to all viewing and listening public and to members of the media. So I represent the Directorate of Women's Health, which is a unit at the Ministry of Health, and we are responsible for measures which are designed to improve the health of our mothers and newborn infants. This is actually an update on the information that I would have previously shared on COVID-19 as it relates to pregnancy and a newborn infant. It is based on the continued, updated scientific evidence. This information has evolved several times over the course of the pandemic. I will also reinforce the general information on the current vaccines that are being used in other countries under emergency use authorizations as it relates to pregnant women. Can I have the first slide, please? So on the first slide, I actually have a graph of what occurred in Trinidad and Tobago in the year 2020 with regard to the number of deliveries we had. I put the years 2018, 2019, and 2020. The top line represents 2018, the middle line 2019, and the lowermost line 2020. It is easy to see that in 2020 we actually had a slight decrease in the number of deliveries when compared to the previous years. So we actually had a total of 15,171 births, of which the majority, 91%, were in our public healthcare system. Therefore, there has not been any increase in births so far or need for any additional maternity services as a result of COVID-19 in our country. Can you come back to me, please? So for the third consecutive year, I want to announce that Trinidad and Tobago has achieved the 2030 Sustainable Development Goal targets for the areas of maternal mortality and neonatal mortality. The tremendous work of all of our healthcare and support staff must be acknowledged once again. In many countries, maternity and newborn services were severely disrupted, and they have seen an excess in mortality. Also, in many countries worldwide, there have now been many documented deaths in our pregnant women. Thankfully, our country is in a good place with no maternal deaths in Trinidad and Tobago from COVID-19. Unlike other countries, all our usual maternity and newborn services have continued to function as normal. We have successfully implemented isolation and other workflow changes and other protocols at all our public healthcare facilities to ensure our patients and staff are protected. Can I have the next slide, please? So, 39 women in Trinidad have been affected by COVID-19 from our latest data, and these were different stages of pregnancy. Some of these women became very ill and required high dependency unit care and intensive care unit care. However, all mothers and their delivered infants have been successfully managed to date. No newborn baby has been affected or has had to be hospitalized as a result. There have been no pregnant women with COVID-19 in Tobago to date. Next slide, please. The overall risk of COVID-19 on our pregnant women are slightly higher than that of the average healthy population. Data is now evolving, suggests that preterm labor is slightly increased in women with COVID-19 if they are in the last few months of pregnancy. There's still minimal or little risk of transmission of COVID-19 to the unborn baby or to the baby after delivery. Additionally, there does not appear to be any risk of abnormal fetal effects in babies born to mothers with COVID-19. Breastfeeding is encouraged in women with COVID-19 once they are well enough to do so. Breast milk has antibodies which passes on some immunity to the nursing baby against COVID. Next slide, please. The following pregnant women have a higher risk of getting severe symptoms and a higher chance of being hospitalized. These high-risk women include those who are obese or overweight. Of course, if you have other pre-existing medical conditions, if your blood sugar is high, heart conditions, asthma, cigarette smoker, hypertension, these are all examples. If you are older when pregnant, and in this case we're talking about a young woman but over the age of 35, and if you are in the last trimester, the last 3 months of pregnancy. Next slide, please. So, though the science and technology behind the development of these vaccines have been used for many years in the development and rollout of many other vaccines, pregnant women and breastfeeding women were not included in the clinical trials on the present batch of COVID vaccines. We simply do not have enough data to make a clear recommendation on this vulnerable population. Our country will therefore follow the advice from the World Health Organization when it comes to the emergency authorization use in the population of Trinidad and Tobago, and of course utilize our own country's situational analysis, which may differ from many others in the world. In simple terms, as we await further data and additional study publications, the vaccine will not be authorized for use in Trinidad and Tobago for pregnant or breastfeeding women during the initial rollout. So can you come back to me, please? So what can we do to protect ourselves, to protect these vulnerable women? Well, the short answer is to observe all the measures that you are currently following. And I'm going to repeat these measures as these women, of course, can't stay at home. They need to interact with the healthcare system. So you need to observe all public health measures at all times, especially when you are attending to your healthcare provider. You're going to clinics. You may need to go for blood tests, ultrasound appointments, emergency visits. You may need to be admitted to the hospital. And of course, labor, delivery, and postnatal care are essential. Wear your mask. Avoid unnecessary touching of your face, nose, eyes, or mouth. Your mask must be well-fitting and cover your face above your nose and below your chin. Wash your hands regularly. Sanitize often. Walk with your personal alcohol-based sanitizer. Ensure physical distancing is observed. Avoid crowds. Do not socialize. Now, sometimes you're in clinic and may be there for a while. If you have to eat or drink, find a safe space away from others if you need to remove your mask. And of course, avoid unnecessary interactions from persons outside your household. Practice good cough etiquette and cough hygiene. Now, if you are unwell and you're pregnant, if you have symptoms suggesting of infection, if you have a cough, fever, if you have difficulty breathing, call your nearest healthcare provider or the ambulance service at 811. Avoid traveling by public transport. If you are pregnant and you have to work, please discuss this with your employer, especially if you are a frontline healthcare provider. In closing, I want to again express my thanks to all our healthcare workers who have been at the forefront of the COVID-19 response. Thank you for your attention.
Thank you very much, Dr. Serju Singh. And now we move to Dr. Paul for an update on COVID-19 and children. And Dr. Paul was here previously and she has some new information to provide us with.
Good day, CMO. Good day to the Dr. Ade Serju Singh. Good day also to members of the media and also ladies and gentlemen. I'm here to discuss about the updates with regards to vaccines and COVID-19 updates in children. Can we have the first slide, please? All right, as we go through, next slide. Next slide, please. Thank you. So we've heard lots of information in the past few weeks with regards to the various vaccines. We know, for instance, the ones we're getting will be the AstraZeneca vaccine. We know the others are the Pfizer vaccine, also the Moderna vaccine. There have been a few from India and also China and Russia. But the main ones we have been getting are the WHO-approved vaccines, and they should be coming out soon. Next slide, please. Next slide. As Dr. Surjit Singh just mentioned, in terms of pregnant women, it hasn't been approved for pregnant women, but also these vaccines have not been approved for children, use in children. It's just a matter, as he mentioned, in terms of data. We haven't had a data for it, so we can't go to start using it in children. So right now, AstraZeneca, they are going to do some research and some trials with regards to the use of the vaccines in children ages 6 to 17, but for the while, it has not been approved. What that means, though, as we roll out the vaccines in the next few weeks, in terms of having the healthcare professional first, the frontline workers for the next, and also the vulnerable members of the population, it means that the children would not be vaccinated. It also means that they are at risk of having the infection continue. They're at risk of picking up COVID-19 infection. Can we have the next slide, please? So as we go through, we know for a fact, as we discussed many times, that all children usually have mild infection, but significantly, we still have the uncommon, but still there, the case of MSC, which is M, multisystemic, I, inflammatory, S, syndrome, or multisystem inflammatory syndrome in children. Now, that's still there. I spoke to Dr. Ramroop this morning. Dr. Ronan Ramroop, he's our cardiologist, and he has said up to this date, we have 26 cases of MSC in Trinidad and Tobago so far with children. Significantly, I always try to come to you guys with full updates. I spoke to all my colleagues in the region this morning and also last night. And so far, although we have had some cases of MSC in Bahamas, Jamaica, and Barbados and Trinidad, I can confirm that yesterday we had a death from MSC in Barbados. So we've had no deaths in Jamaica, no deaths in Bahamas, no deaths in Trinidad so far, although we have had 26 cases. But in Barbados, we had a death in a child yesterday. The PCR was negative, but everything else was positive. And this child showed classic symptomatology of MSC. What it means, though, is that we're not going to be complacent. We acknowledge that this category of our population, as we vaccinate, our children would not be able to have the vaccine, and they are still at risk of having mild infection or also having more serious infection like MSC. And we have to be as aggressive and keep monitoring these children. Obviously, in Trinidad, as we mentioned before, we've had our protocols since last year, really aggressive. All the emergency rooms have had the strict protocols, and as soon as the kids come in, we jump on them in terms of trying to start the medication so we don't have any possibility of mortality per se. Next slide, please. Aside from having risk of infection, the children, though, because they've not been vaccinated, will also have risk of transferring the infection on to those vulnerable populations. As we mentioned before, the pregnant women, we have the elderly population, but still remember the diabetics, the obesity, the ones who are smoking, and all the others with comorbidities. So we still have to have our children maintain their public health guidelines. Though I know we've said it many times, and I really need to reiterate so it becomes a normal routine with us. So we're looking at keep your children with their mask on, wash their hands, social distancing, small groups, especially when they have to come and interact with persons in your household or outside in the population, and especially those vulnerable groups who have not yet been vaccinated. So we're in a sort of like balance right now. As we roll it out, as we get more protection from the vaccine, that group are still at risk of having the infection and also passing on the infection. Next slide, please. What we also have is we have those children in schools. What they've found in the rest of the world it's a tight balance because you need to have the children come back to school. It's really important. But at the same time, we acknowledge that in school, we have the increased surge. Once you start children in school in terms of classes, you have an increased amount because, of course, once they're there, even if they have their measures being in place, there is a small surge in the amount of transmission and cases. So that means we as parents, we as a population, have to make sure our children do their part at school and as we roll it out, because really and truly, we all want our children to go back out to school. So once we have it where we get vaccinated, as it rolls on, we'll have more and more classes being open, school being open further, as long as there's no massive surge in the amount of cases with the children. So the same thing, mask up, wash hands, even in school, social distancing, and of course, small groups. Next slide. Now, I want us to think about the center of it. So last year, we focused on the physical and acute aspects of COVID. What we found, though, it's sort of like a ripple effect. The next stage is a long COVID, L-O-N-G, long COVID. Now, we've heard about long COVID in adults, but what they found is that in children, long COVID has been underestimated. So lots of children who have had COVID and then misc, they've had 3 months and further on where they still have symptoms. They might have rash, they'll have still heart issues, lung issues, but more significantly, they have things where they're lethargic, they're still having fatigue, they have joint pains, and they're still not able to go back into society in terms of go back to school. They still have no energy. So we still have to look out for that long COVID symptoms. For those parents out there who have had their children who have been confirmed COVID positive and who have also had misc, still monitor your children because up to 3 or 4 months, they can have signs and symptoms of long COVID. Next one. And of course, what I really want to impress upon us today is about the mental health. So we know when we first started, we were all concerned watching the numbers and we had lockdown. We were listening to the Ministry of Health, and then we started school in September. Now, when the children first started, there was online schooling, and I think it was new, and both the parents and the children were trying to manage with it. What we found, though, is that in the past, say January, February, we've had some COVID fatigue. So a good few of those children have been lost and untethered because they're not managing. In fact, some parents have told me that they even do the classes for their children. They might do homework for their children because, of course, some children are not managing. What we found with the COVID fatigue, especially with regards to the males and with regards to that age group between 10 and 15, the younger adolescent, what happens in terms of how the adolescent brain functions is that it's really important to have this social network. So at that age group, their parents aren't the most important, the family is not the most important. They provide some structure and support, but they really get their validation and their self-esteem and their sense of worth from their crew, their social setting, their group of friends. And so without that, which is what's been happening since September, especially for those who have started in Form 1, those who have changed schools, those who have even gone from Form 1 to 2, where you haven't had your base of friends, you haven't had your tribe, your crew, it's really been difficult for them, and especially the boys, they've been untethered and lost in the whole thing. And in fact, for the past month, we've seen a really sharp increase in the amount of cases who have had referrals. So previously, I would have like about 2 referrals to psychologists, psychiatrists, 2 per month, even the adolescent pediatricians. In the past month, I've had like 15 children who have had to refer for depression, just for not managing ADHD in terms of attention deficit disorder, hyperactivity, and just being lost in the whole thing where they don't have their social structure there, which is important to them. So I really want us to be aware of the mental health challenges. Now, we know we've been stressed by this, but our children at this point in time, they've been having significant COVID fatigue. So I want us to think about doing things to mitigate this. For instance, having maybe more online groups just for your children to meet up with their friends, or the class to have some social time to try to get some crew going there, or even having after school some Zoom sessions with their friends, and they can have their small group of friends that they build on and hang out. And of course, if you can, in your own social structure and in your own home, if you have a few of your family members in your pod who are about the same age, let them hang together for a bit so they can actually, even if it's about 3 or 4 persons, it's really important for the adolescent, and they have been having a hard time. But I think although they've been having a hard time before, it's now much more acute because they're becoming tired. So watch out for your children. Next slide. This is really just to show us that I want us to look at all 3 at the same time. So it's really about the fact it's not happening where one is finished. For this entire year, we're going to have our acute presentations, our missy cases, our long COVID, and at the same time, the larger circle will be our mental health issues with our children. So we have to watch in terms of the short term, the long term, all through the year, to be watching all 3 areas, to be managing those, aside from holding the line in terms of our public health measures. Next slide. So I know this song's corny, but it's really in our hands. Not just washing our hands, but it's in our hands. The difference is us. If we can maintain and hold that line as we transition, as we have vaccines being rolled out, and as we see the tweak and the fall of numbers, and as we try to bring our children back to school, we have to monitor and continue with the public health guidelines. All those things we've been rehearsing over and over again. It's really important. It's up to us, for us to take our responsibility, take our health as our responsibility, because we, as a public, it's not the Minister of Health, it's not the Chief Medical Officer or Dr. Ade Sturgising, it's actually us and in our hands. Next slide. So in summary, I want to reiterate a few things. No vaccines for children yet. It's not been approved. So they still can be infectious and transfer the COVID-19. Missy is still significant. We've had 1 death so far in Barbados yesterday, and that was confirmed. Number 3 is that we have to think about long COVID, look for symptomatology of that. And number 4, really importantly, think about your mental health and how are you maintaining that, but think about your children's mental health. They have been having a hard time, and they also need some support with regards to that, especially that 10 to 15 age group. And really and truly, we have to, it's a marathon this year. Don't think about it where, we had just had Valentine's, we in the middle of not having carnival, and we're going through this year thinking it will be soon over. I want us to see not a 5K, not a 10K, it's a marathon this year. We will survive it, and we'll go through it and achieve and go further one step at a time. Thank you very much.
Thank you very much, Dr. Paul. And you just highlighted 2 critical areas. Taking care of our children's mental health, very important, and ensuring that they are protected physically. You mentioned as well that our children will not be able to take the vaccine, at least in the initial stages, until there's more data. And so it becomes even more important that all of us adults 18 years and over take the vaccine as soon as it is available to us. And we go now to the question and answer segment. Members of the media, please indicate your name and the media house that you represent. We'll take 2 brief questions at a maximum from each member of the media, and please ask both questions at the same time. We begin this morning with questions from AZP News.
Hi, good morning. Priya Bihari, azpnews.com. My first 2 questions are for the CMO. CMO, I wanted to find out what happened to the 2,000 vaccines that we got originally from Barbados. Can you tell us where they are being stored, etc., and who are will they be designated for? And my second question would deal with when eventually we may have more than 1 vaccine for distribution in Trinidad and Tobago. In a case like that, would the people who have been vaccinated, would they have a choice? In other words, can they choose which one they would have wanted? Thank you.
Okay, so thanks, Prior. So the 2,000 vaccines, I think Dr. Hines would have mentioned, would have come in late last week. they were taken to storage at the appropriate temperature, which is 2 to 8 degrees at the C40 storage site. So that is being housed there for now until WHO has given approval for use, and then of course we can use it thereafter. With regards to our first tranche, if we have these 2,000, it will be used for the very high risk healthcare workers in the first instance. For example, those persons who are at CUVA, CORA, who are actually interacting with COVID-19 patients on a daily basis, those at REMA, those at Augustus Law, and persons who supervise quarantine individuals as well. So that's for the first 2,000. With regards to your second question, you asked about use of different vaccines. So if we do get the AstraZeneca vaccine plus the Pfizer vaccine, it will be determined at a national level in the first instance which groups we want to use different vaccines on. For example, the Pfizer vaccine WHO has approved the guideline and sent out recommendations for use, and they have said that persons with severe allergic type reactions would not be advisable to have that particular vaccine. With regards to AstraZeneca, they put out an interim guideline which suggests that we may be able to use it in those individuals who have not had severe allergic reactions to components of the vaccine, but had other types of reactions in the past. So it may be there may be slightly differing groups that you want to use it in, but that will more than likely be determined at a national level in terms of target population.
Thank you very much, CMO. CNC3, we're ready for your questions, please.
Hi, morning everyone. Rashad Khan here from Guardian Media. So my two questions are just for some clarification. So Dr. Sirju Singh, you would have indicated that the vaccine, at least this first set, won't be for pregnant women. I just want to clarify, is it just this AstraZeneca vaccine, or is it any of the other candidates that right now it doesn't look like they should be for pregnant women? And Dr. Parasram, you mentioned a bit about some other illnesses within the population, the endemic illnesses, and how they are at low levels. Is it possible that through continuous adherence to the public health measures for COVID-19, that we could probably get rid of some of these illnesses that are circulating within the population?
You want to go?
Yeah. So thank you, Richard, for the question. So for clarity, so far that the data that we have received for all of the current vaccines that have been released, none of these have actually been studied in the pregnant clientele or in breastfeeding women.
Okay. Yeah. So with regards to the endemic channel, yes, we at a very low level, lower than we have seen for many years. For most of the viral illnesses in the population, it will be a good thing that if we can eradicate a few of them, meaning a few subtypes of viruses that may be circulating. But I don't know if that is indeed possible through these measures. However, there are vaccine preventable diseases that we already give vaccines for. Together with the public health measures may have some great impact in terms of those particular illnesses, but it will be good to actually have the eradication of certain types of viruses as a sort of side effect from the public health measures.
Thank you very much, doctors. We go now to Wired 868, please.
Hi, good morning. Fayola Bostic from Wired 868. My first two questions, I think, go to the CMO. So the first question I have is with relation, if you could give us some idea about the process for how vaccinations will be rolled out. If we're starting with healthcare workers, for example, would they have like alphabetically? Would they have to go by district, and then doctors who are in private medical institutions, how do they get their vaccines? If we could get just some idea about the details of the process itself, how that would be rolled out. That's my first question. My second question, do we have any idea in terms of excess mortality in the country, how the COVID pandemic has affected the country in terms of excess death?
Okay, I'm not sure about that. All right, okay. So your first question speaks to the process. So I think we have divided the process into two phases. So there's phase 1 and there's phase 2 of the rollout plan. Phase 1, it is really the high-risk groups, and we want to target, I think your focus is really on healthcare workers. So healthcare workers are in phase 1. They're the first part we would be rolled out to in phase 1. And healthcare workers can be broken into 2 broad categories. Those at the front line. So even within healthcare workers, as I spoke to a prior question with regards to persons who see COVID cases on a daily basis or who may interact with suspected cases, those persons will be, of course, given first vaccination. But we intend to do in the rollout plan vaccination across the boards, across the RHAs at the same time. So there will be concurrent vaccination occurring across the country, including Tobago, at the same point in time for healthcare workers. We won't do one facility first and then jump to another one. We'll do everyone at the same time once the first tranche of the COVID vaccines from the COVAX facility arrives into the country. With regards to private sector, again, the healthcare workers in private sector will be included. And through the ministry, we will partner with the private sector entities and TTMA, the Nursing Council, to ensure that that happens at the private sector as well. We will supply the vaccination and they will supply the human resource to do so. Your second question, if you would just want to repeat it quickly, I'm not sure I understand what you're trying to ask exactly. Just repeat that second question.
Sure. I'm just wondering whether we've seen, if we have any numbers in terms of excess mortality, in terms of whether or not our 138 deaths that we've seen to COVID, have they had an impact on the excess mortality in the country, like more deaths than we expected for the year or anything like that?
So they, yeah, I mean, I'm just trying to understand what you interpreted by excess mortality. So we have the 138 deaths. Again, we didn't look at it in the context of it contributing to deaths on the whole from all infectious disease or from all deaths in the system. But again, it's excess deaths from a particular disease, right? New deaths that we would not have seen before. Last year we would have had deaths, for example, from influenza. COVID would not have been here. So it would be considered excess in the sense that it is from a new disease to the country. That total number, we can look at the statistics and see if we had drops in other areas, for example. We may have had decreased mortality from some other diseases. For example, as we showed the endemic channel, we would have seen a drop in acute respiratory illness, you would have seen a drop in gastro, and of course they may consequently have decreases in mortality from those particular illnesses, and we can certainly look at the trends and let you know in the near future what has happened.
Thank you very much. We go now to TTT, please.
Good morning. Terry Ann Brown Campbell from TTT. I have 2 questions, both for Dr. Paraxram. What percentage of the population is not going to be vaccinated? In that children, pregnant women, persons with allergies are not going to be vaccinated because they can't get the vaccine. So at what level is that? My second question is regarding the COVID-19 public health regulations. In the regulations, it indicates that we shouldn't have any fetes or no parties in public spaces, yet we're having these events in Queen's Hall. How is that? Those are my 2 questions. Thank you.
All right, so the percentage of what we're trying to achieve long-term in terms of herd immunity is we're trying to get 70% of the population vaccinated. I think when you combine children together with pregnant patients, that's far less than 30%. So we should be able to achieve herd immunity, but it means that we need a larger proportion of the persons that actually can take the vaccine to come out and actually take it. Because we have 2 vulnerable groups there that at least at the outset can't have the vaccine. So we need to create a herd around them to protect them. So it means more so, seeing that we don't have this large group of people that can't be vaccinated, that everyone else needs to play their part and really come out and be vaccinated. We need to get those numbers in the vaccine, the persons that can have the vaccine, to a very high level, of course beyond 70%, to get to a population level of 70%. With regards to your second question, again, our guidelines have been out for almost a year now in terms of how people should behave, how people should gather. The public health guidelines have long been noted. It is something that is in law in terms of the regulations. And really and truly, to the most part, the majority of the population has abided by the public health regulations. And I think we are seeing that in the numbers today. For the few that have not, we have continued to call on them to comply with the public health regulations. Again, both in whatever gathering you may have, that you try to maintain the public health regulations as it speaks to 10 at this point in time in a public space, and of course maintaining all the other guidelines, mask wearing, which is of course made mandatory by law in a public space as of August, end of August. We're really calling on everybody to play their individual part and collectively continue to do the public health measures so that we can continue to maintain the low levels that we have been seeing over the last couple of weeks.
We go now to questions from Newsday, please.
Hi, good morning all. Shane Superville from the Newsday newspaper here. I have two really quick questions. The first one can be answered either by Dr. Paul or the CMO, Dr. Parashram, and it has to do with whether or not the Ministry of Health has received any feedback from the Ministry of Education in terms of reintroduction of new protocols to try and reduce potential infection as school has reopened. Just really to kind of get some idea as to what the feedback on the ground has been like, seeing as how school has been open for some students as of last week. And the second question has to do, well, can be answered by Dr. Serju Singh, which is, what are some of the implications or the effects of a low birth rate on the population? Much thanks.
Okay. So in terms of the first question, you're asking if the guidelines are being adhered to at the schools, yes? Mrs. Yeah, so I mean, the monitoring of the we have been working with education with regards to the guideline development. And of course, the guidelines were eventually put out by the Ministry of Education, and they continue to do the monitoring and evaluation exercises along with some oversight from our CMOHs. So if they do get cases of illnesses, they will liaise with the respective CMOH so that we pick up the cases. And of course, we do early testing to see what the cases have been. But again, that initiative with making sure the guidelines are implemented falls under the Ministry of Education. Dr. Sujasingh?
Yeah, so thank you for that question. So you'll have to remember that these are, for now, yearly calculations that we are looking at. So there are trends and there are highs and lows. So it's a little too early to say with certainty that we have a totally declining low birth rate. What we will do is consider the information and, of course, consider it at the Ministry of Health and then inform other stakeholders to see any national policy changes will be required when it comes to consideration of that low birth rate. Okay. Thank you.
In terms of the question asked about the excess mortality, I have some data that suggests that there's no excess mortality. The data we have so far is up to November of 2020, and we'll get the other few months in the near future. But the numbers have been low over the last few months. So I expect that it will be maintained the same, and we'll be able to say that there has been no excess mortality in those months as well.
Thank you. And we go to Express for two brief questions, please.
Good morning. Kim Bodram from the Express. CMO, just to revisit the vaccine, the license for the vaccine, from the World Health Organization quickly for general benefit. Can we just clarify again how that works from the WHO? Is that normally how vaccines work, that they become involved and countries await a license from them? And does that affect our timeline? Just to revisit that in terms of the timeline we are looking at rolling out. Also, the public health regulations, which, as you said, have been out for a while and people have to adhere to them. It's an individual responsibility. But we get a lot of reports of some public transport areas, if you want to call it that, the smaller maxi taxis, etc., for some time now, probably since Christmas when the public has been out some more, have just gone really back to the normal way of things and are filling up the maxis. Some taxis are doing it. And some relaxation too in some of the retail stores in terms of how many people they let in. Just how the medical team revisits that issue from time to time to ensure that some areas are maybe better policed than others if people are not adhering, because the numbers have been low for a little while, but that has also been going on a little while. Thanks.
Okay, so with regards to the vaccine regulation, so the reason the World Health Organization would go through this rigorous process is to ensure the safety and effectiveness of any vaccine that they are releasing to their member states. So they have member states all over the world, upwards of 190, that they have to assure when they give the go-ahead and when they give the approval that the use in those countries will be safe and effective, and hence the reason we rely on WHO for all our vaccines for many, many decades to ensure that they are safe and effective. And we won't be distributing the vaccines or using the vaccines until they have that stamp of approval, which is called an EUL or EUA, which is a license to use from WHO in conjunction with the SAGE group, which is a strategic advisory group for vaccines. The medical teams, again, we create the guidelines. As you said, they have been out and about for a number of months. We continue to do our communication plans to ensure that persons at least know what the guidelines are and that they abide by them. However, the enforcement does not fall within the Ministry of Health. We're asking people to, of course, take your personal responsibility and do the right thing. But at the end of the day, enforcement falls outside of our remit.
Thank you. And now I think we have questions from CL Communication, please.
Hi, good morning.
Okay, wonderful.
Can you hear me?
Yes, we are. Good morning.
Okay. One of your charts pointed to a decreasing number of people having flu. Is this a good sign, and what is causing that trend to happen? And then secondly, how does the kids going back to school and not being able to get the vaccines and the fact that they have to return to school, what is being done to ensure that there's no spreading of the virus? Thank you.
Right. So the chart with regards to influenza and COVID-19 are almost the same in terms of transmission. They're both by respiratory droplets, and we expect that what the measures we put in place to control COVID-19 will also have an effect on influenza. In addition to which, we have been giving out vaccines, as you know, for influenza for many years. Last year, we would have given out about 118,000 doses to the population. This year, we would have been just over 65,000 so far since the beginning of the flu season. So the combination of vaccination together with the public health measures would have gone a long way to actually bring our influenza numbers down substantially to a very, very low level. And we are thankful for that. We haven't seen any deaths from influenza for the 2020 or 2021 as yet as well. I don't know if Dr. Paul wants to go into the second bit of the question.
Sure. Yeah, we go to Dr. Paul for response to the second question, please.
Thanks, CMO. I think the fact is, as you mentioned, that the kids aren't being vaccinated, but as we roll out, it's going to be a watch carefully. So I think that the Ministry of Education has been really clear on this. We start out with small groups, see what the surge is like as we vaccinate further. And as we have maintained those guidelines, those public health guidelines, if we find that the numbers aren't increasing, then we go again. As you know, we discussed it before, the children have less receptors. So in terms of one-to-one, they transfer, from child to child transfer is less than adult to adult. But once you have lots of children, you still have that increased transference. But the fact is that once we have herd immunity going through, as we vaccinate more, then we have less of that, we have more protection for our children, so less transference. So I think it's a matter of time. It's a matter of one step. Start with 1 or 2 classes, see what the response is like, and then as we go through, have a next one open, review and watch. And that's what lots of the countries have been doing. They go 1 class at a time, see what the upsurge is like, and then review and then open up again. So as long as we vaccinate and all of us doing our public health measures, then I think this will mitigate the transfer even in the schools, and eventually, as per other countries, we will be able to have all children back in school. Thank you. Hope that answers your question.
Thank you, Doctor. We have a follow-up question from AZP News now.
Hi, good morning again. CMO, since we seem to be not having a large increase in number of COVID cases, some people are asking when the ministry would advise to lift the ban on contact sports. Can we see that maybe, in the near future? Thank you.
Well, again, the Ministry of Health will continuously make recommendations as it relates to the public health measures that should be in place, but that decision ultimately lies with the Honorable Prime Minister to make that final decision. So in the coming weeks, when we advise, as we usually do, we will consider all things being equal. If the numbers remain the same, we can make further recommendations then, but we want to preempt what the Prime Minister would decide.
Thank you. Now a follow-up question from Wired 868, please.
Okay, so just one quick question again. I'm wondering what is the follow-up that is the ministry has any follow-up in place with people who have had confirmed cases of the virus to see whether or not our numbers in terms of long COVID reinfections or new infections are occurring in the country. So is there a follow-up procedure in place, and what have we been seeing in terms of the cases we've seen from since March last year?
Right, so we follow up the persons for a certain length of time, just under a month thereabouts, when you are discharged into the community in most instances for quarantine purposes, to ensure that you don't you're not infectious before you go back out to work or go back out to any other place. So the average time for follow-up generally speaks to about a month, and we have not seen a lot of those individuals come back with any significant infection. But the long COVID numbers, I can get to those figures from the clinics at the North Central Regional Health Authority in particular, who actually has a long COVID clinic set up, and they can probably give us some idea of the numbers that they have been seeing in that particular clinic. So I can get that to you.
Thank you very much. And we go to Express, please, for a follow-up question.
Good morning, Kim Bodram again. Thank you. CMO, again, just to revisit the vaccines for people who are being repatriated. If it is my understanding that you have to have your vaccine at some point in place before you return, you're allowed to return to Trinidad. I think that's unclear to some people along the way, and also whether people who are still abroad and having problems getting home, some of them are calling us to say that they don't know how to get the vaccine, they can't, it's hard to access, they are not in a place that they, etc. Is there anything that the Ministry of Health does to assist people getting the vaccine abroad before they come home? So just some clarity on that holistic.
Just to clarify the issue, persons who are coming into this country, the only requirement we have as a country is that you have to provide a PCR test 72 hours before you actually board the aircraft to come in, and you have to show proof of that to the person before you board. So there's no requirement to have a vaccine before you come to Trinidad and Tobago at this point in time. And again, the other bits of it in terms of providing vaccines are individual responsibility, but we don't require it before you come back in one of our repatriation flights. Only thing you require is a PCR 72 hours prior to boarding the aircraft.
Thank you very much to all the doctors on the panel today. We have come to the end of today's media conference. Thank you again, everyone, for your participation. I hope you continue to stay safe within your household bubble and enjoy the many carnival events that are shown virtually, as I did this weekend. And if you do go out, please follow all of the new normal guidelines. Stay away from others, including family and close friends who do not live in the same household with you. Be safe and, of course, wear your mask.
You're supposed to be relaxing.
Well, I'm going to get some bacon shark.
Oh, all right.
Yeah, me, my boy, yeah.
Just remember, it's still a COVID out there. Beach or no beach? Yeah. Hey, you wash your hands? Where's your mask? You know what? 10 things to remember when you're by the beach. If you're sick, stay home. Wear a mask. Oh.